Rebecca Oas of the Center for Family and Human Rights is blowing the whistle on Sweden. In her recent article titled "Rich White Sweden Targets Poor Black Africa," Oas says Sweden will spend $60 million in the next 4 years to promote abortion on people who don't want it.
I mean, Africa is the region of the world with the greatest number of countries. So from a voting bloc standpoint, they could be very powerful if they speak together. Also, we know that Africa is the region of the world that still has above replacement fertility. It has the highest fertility in the world. So obviously, for those who are concerned about population growth, it has long been a target. And of course, the narrative that we hear is that these poor women, they don't have access to family planning. They cannot control the size of their families. We must help them. When in reality, when you look at how many children women want to have, it is also the highest in the world in sub-Saharan Africa. They want large families.
And Africa remains the most pro-life continent on Earth, with 9 countries banning it outright and only South Africa having no restrictions. But under the guise of healthcare, global family planners, funded by Sweden and other enlightened Western democracies, have been undermining Africa for years.
We've already seen how this plays out in other parts of the world where abortion restrictions exist still, in parts of Latin America, for example, where long before the laws were liberalized, even if they were, there was this black market for abortion pills. And so we've seen, some of these groups like Aid Access that's now trying to ship abortion pills illegally to women in the United States. We've seen that same model happening overseas, the Women on Web group, which is founded by the same person, where they've been illegally providing abortions, around the world using pills as well as surgery. But especially as it's moved toward pills, it's become much more easy to get it into countries where it's illegal. And there are all kinds of risks associated with that. But, and of course, in our work at the UN, we see that the World Health Organization has been providing a lot of medical cover for this practice. They've basically framed abortion as a form of self-care, where, you don't need a doctor. They've been expanding the pool of potential providers to nurses and midwives and lower tier medical workers, even potentially pharmacists, which brings all kinds of conscience issues in as well. But, in addition to that, women themselves as providers. And so what these organizations do that are selling illegally abortion pills is they say, well, we're operating in accordance with WHO guidance. And so the WHO is basically providing them at least medical cover, if not legal cover, and saying, well, abortions that are illegal aren't necessarily unsafe if they're provided in accordance with guidelines by the WHO.
One of the words that we always hear is self-care. Do you cringe as much as I do when you hear that word?
Oh, yes, of course. I mean, and we see this, the word abortion is often bracketed by it being safe abortion care, when you hear proponents talk about it. It's to put the word care there, making it sound like you say, like something that's not lethal. But yes, absolutely. The idea that, and also we hear, it being spoken about as something that is empowering, right? That it's about controlling your own body and, determining your own destiny. And, definitely trying to distance oneself from the idea that in order to self-actualize in this way, someone else must lose their life. And so, yes, you're absolutely right that this is a huge language issue.
The good news is the Swedens of the world have been punched in the gut by the overturning of Roe v. Wade, and African nations who aren't afraid to take a stand.
Well, I mean, one of the things that the abortion movement has been saying for a long time is that there's sort of this inevitable wave of change happening, and that, country after country is falling, like you say. And it is certainly true that some countries have fallen in pretty catastrophic ways on this issue. There have been, a few countries that have, in fact, strengthened their pro-life protections in law, in addition to the United States. And of course, the United States is huge in this regard, that even under a Democratic administration, this happens. And so, it's not that this is an inevitable wave that only goes one direction. And of course, the U.S. is helpful in pushing back on that narrative of inevitability. And it also has to be said, that in all of the decades that they've been trying to push to create an international human right to abortion, and these are the most wealthy countries, the most powerful people in the world, they have still failed. Yeah. There is no consensus on this. It's not in any binding international human rights treaty. So, there is a lot that we can say we've had as successes. Certainly with a lot less funding behind it. So there is good news.